for less.
Welcome back, everybody. Finding the time to make sure that your kids are healthy and ready for school isn't always easy, but there is a mobile clinic in the district that is helping parents do that. This morning, we are joined by Dr. Janine Rethy, who is with MedStar Georgetown University Hospital, who has some tips about this and, of course, the Kids Mobile Clinic. Thanks for joining us.
Thanks for having me.
All right, let's start to talk about the clinic. You have this Kids Mobile Pediatric Clinic, community clinic. Tell me exactly what it is, if I'm saying that right.
Sure. The Kids Mobile Medical Clinic, or Ronald McDonald Care Mobile, sees pediatric patients around the city. At the moment, we see about 800 individual patients per year and provide comprehensive pediatric care.
Okay.
So we see kids from 0 to 21 years old. And we do everything from well child checkups to sick visits, vaccines, lab visits, fluoride varnish.
Wow.
We do mental health screening. We do social health screening. We have a care coordinator, a social worker. We even help our patients link them to legal needs if they need it.
Wow. So you have this really comprehensive health bubble all in one location for residents. Why do you think that's important?
So I think what makes us a little bit different is that we take this comprehensive integrated care and take it into the neighborhoods where our families live. So our state-of-the-art mobile medical unit goes into neighborhoods and takes care of patients where they live. In addition, we feel that we need to provide the ultimate access to care and decrease as many barriers as we possibly can. So we never charge any patient a penny for the care that we provide, in the hopes that most patients who want to have well child care can have easy access in a place that they feel comfortable.
What's really impressive about that is I think a lot of parents may feel overwhelmed. They may not have the finances and they're worried about the time, and you guys make that convenient for them.
That's the idea.
Yeah.
That's the idea. So our belief is that every child deserves the opportunity to be healthy and to thrive. And so the idea for this came from that concept. And we wanted to build a program where we decrease every possible barrier to healthcare and really provide the highest quality of healthcare that we can and the greatest amount of access. So we built and operationalized this unit with that in mind, and we are now in our 28th year.
Yeah, which is so impressive to think about all the kids that you've helped all this time. And speaking of the kids that you have touched, you focus on wards 6 and 7, but tell me how comprehensive in terms of coverage this is, because you said that you also provide service in ward 8. So where do you cover?
Right, so our division is the Division of Community Pediatrics, which is within MedStar Georgetown University Hospital, Department of Pediatrics. And so our mission really is to decrease health disparities throughout D.C. So our one program is the Kids Mobile Medical Clinic, and right now we are seeing patients 4 days a week in Ward 6 and Ward 7. We also have 2 school-based health centers that actually both started out as mobile clinic sites, and now are full brick-and-mortar sites in Anacostia High School and in Roosevelt High School, and those operate 5 days a week, also delivering integrated primary care services. And our final program is our fitness program, which is another mobile medical clinic, and we partner with elementary schools and middle schools throughout D.C. to help students, the schools, and their families have more access to healthy living, nutrition, and physical activity.
What's really nice about that, too, is you're really giving a very well-rounded health approach for students. And I want to mention that because the school year is starting, and a lot of kids have to get back on board in terms of making sure their medical forms are up to date, their immunizations. Can you talk about the immunization and the medical forms being up to date for?
Sure. Yeah, this is a very busy time of year for all of our practices as our students get ready to go back to school next month already. So the American Academy of Pediatrics recommends that all children receive a well child checkup every year. And DC Public Schools actually requires an up-to-date school health certificate that includes an up-to-date well child check and all of their routine vaccinations being up to date as well. So when our kids are coming to us for our physicals this summer, we're completing their well child check, their history, their physical, making sure that their vaccines are up to date as well, any labs that they may need. But in addition, we really spend a lot of time with families helping them find ways to be healthy and safe, and also connecting them to any community resources that they may need, so they're really ready to jump into the school year happy and healthy.
When you talk about the wellness check, what are some of the points that you have parents go through? What are you looking for, and what do you think a student needs to be ready and healthy to enter the classroom?
That's a great question. So we're really looking at the whole child within their family and within their communities, and we want them to be in a place, again, where they're happy, healthy, and thriving, so that when they do start school, they are ready to learn and be their best. So our well child checkups include a comprehensive history, understanding all about their medical history, their social history, any needs they may have with education, and any difficulties they may have had in the past. We also do a social needs assessment to understand if there's anything going on in their lives, in their families' lives, that may limit their ability really to be thriving in their lives. Once we've completed that, we do a full physical exam that includes hearing screening, vision screening, and then a full physical exam of the child themselves. We do any labs as necessary depending on the needs of the child. For younger kids, we do fluoride varnish to keep their teeth healthy.
Wow.
And then we go into our counseling with the families, and that's often where we spend the most time. So any issues or questions that the families have, the children have about their own health, or anything that may have come up during the visit, we can really spend time and focus with them on ways that we can help them be as healthy as they can, and most importantly, connect them to resources that they may need in the community through our program, through our social worker, through our medical legal partnership, or to our partners in the community beyond.
Okay. And one more thing, with immunizations, how important is that? Because just recently, I'm sure you heard the mayor, Mayor Bowser, announced her Don't Wait, Vaccinate. Can you just touch on the importance of making sure students have their vaccinations up to date?
Absolutely. So the vaccination schedule is set by the CDC, and the American Academy of Pediatrics approves all of those vaccine schedules. Those vaccines have been shown over many, many years to be safe and very effective in helping our children to prevent preventable diseases and stay healthy. So our routines have been in place for many years, and we like to spend time with our families to help them understand the benefits of the vaccines and how low the risk is of the vaccines themselves. The children are having the vaccines to protect themselves, but also to protect their communities. So the more children are vaccinated, the more the larger community is protected in case there's anybody out there who can't get vaccinated for a medical reason, or a young baby. So we like to protect the child and the community.
Okay, great service and very comprehensive for a lot of parents who are getting their kids ready for school. Thank you so much, Dr. Janine Rethy.
It's a pleasure.
Yeah, it's a pleasure, our pleasure, with MedStar, Georgetown University Hospital. If you want more information